I want you to imagine a problem that takes the lives of 40,000 people every year in America and forever alters the lives of millions more. Now I want you to imagine a solution. Billions of dollars have been invested in it as we're proving out the hypothesis that it might dramatically reduce the number of deaths and possibly improve the quality of life of others in myriad ways. It's still early. If it were a drug, it might be in a clinical trial, or maybe still on the bench. But the problem is we're not talking about drugs in clinical trials. We're talking about emerging technology. And whereas the FDA has an approved process for experimentation, for testing on humans, the acceptable level of harm to humans, as well as the appropriate amount of time between discovery and deployment, we do not have that in technology. So my day job is as CEO of Luminary Labs, and we like to say that thorny problems are our strong suit, or strategy and innovation consultancy, helping nonprofit, public sector, private sector organizations answer questions like these. Can voice technology improve the lives of people living with diabetes? Can we use non-traditional data sets to identify biothreats in real time? Can we use simulations, AR and VR, to prepare students for the jobs of the future? Are you going to use data science to kill the pill or make the pill stronger? And typically when we have a new invention, we go through this process, the scientific method: problem, hypothesis, data, conclusion. And what I've observed over the past few years is that many of the partners we're working with are doing something quite different. They have a new method. Problem, hypothesis, deploy, oh shit. Pull back, rethink. So a few years ago, I decided that with these new technologies comes the responsibility of imagining unintended consequences. And in 2018, we are not in any lack of examples. Strava opened up their data earlier this year, you remember that? And exposed a military base that was not meant to be exposed by showing the Fitbit tracking data of soldiers. Increasingly in the healthcare sector, we do a lot there. People's care decisions are being dictated by algorithms. Is it always on? I don't know, Alexa, what do you say? Well, this woman had conversations that were recorded with Alexa, somehow emailed to another third party. That's an edge case that really should never have happened. I became even more interested in this topic when I researched an article I wrote early this year called The Rise of the Health Tech Ethicist. As the way we use devices and apps informs our health, so if you're not aware of this, many people are looking at how you tweet, how you swipe, the things that you do to understand if you have a disease or are probably likely to benefit from a clinical trial. We don't really have a code of ethics. So while health has a code of ethics, we don't necessarily have it for health tech. And after I published this article, it was in March, 2 days later, the Facebook Cambridge Analytica affair came to bear, right? That was a Friday night when that news was dumped. And the very next day, the first Uber death happened. And it occurred to me that we as a society are not prepared for the world that we have programmed. Somewhat naively, I decided to post this on LinkedIn. And you know the rule is like, don't read the comments, right? Okay, I couldn't help myself, and the comments were like crazy town. So there were technologists saying that there's no such thing as ethics in tech. There were people who were saying, well, of course autonomous vehicles are safer, it's proven. And it's not, they're like not even here, right? Like there's parts of them are here. There were people who suggested that the socioeconomic conditions around that death didn't matter. The woman who was killed was homeless and had a bicycle, which is actually the type of accident that should be prevented through autonomous vehicles. And so the conversation goes on and on. After this, I decided I am going to be pro-tech and pro-ethics, and I want to bring everyone on board with me. Are you on board? Yes, okay, great. So let's go back to health. Not the most tech-forward industry, but has really great guardrails that maybe tech should learn from. So the first is we need less programmers and more Leonardo da Vinci. There's a reason why it's STEM over STEAM. Da Vinci was an incredible scientist, and he studied the human body in ways that nobody ever had before. But he was also an artist. So at Luminary Labs, when we found out that Mark Zuckerberg said that back in his dorm room in Harvard, he never could have imagined that this future platform would be used to alter an election, we said everybody should be able to imagine unintended consequences. Just read more fiction. So we curated a list of 40 fictional stories as well as movies, and we published them. You can find it on our website. It's also on Quartz. If you really want to squint, go for it. It's super fun. If you're really busy, a lot of you are, I know you're students, just watch movies. If you remember The Incredibles, which was like the first one is at least 10 years old, the Omnidroid is a self-learning machine. And he goes out, or it goes out, and it kills superheroes. And it learns from how it kills a superhero to eventually kill Mr. Incredible, which he's not successful in, of course. If children can understand the unintended consequences of technology, so can Mark Zuckerberg and so can you. WALL-E is also near and dear to me for the same reason. Now, this isn't just fun and games and fun, something to do for a pastime. The Lowe's Innovation Lab employs speculative fiction writers to understand the future that we're creating. So this is actually happening in businesses today. The second, sort of obvious, make or create an oath. So healthcare is famous for the Hippocratic Oath. It's generally understood as do no harm. Interestingly, the oath has evolved over the years, and do no harm is not part of the original version, but today that's what we understand it to be. And you've probably seen DJ Patel's call for a code of ethics. There's a Hippocratic Oath for technologists. The designers made a kit, and of course they're designers, so it looks really nice, so you can download it, make your own. And the question becomes, should we be creating oaths as industries, as communities, or what about within your company or your team? How might you go about doing that? The third point that I'm going to borrow from health is this idea of informed consent. So at the crux of any medical intervention, whether you're taking a drug or a doctor is telling you to do a particular thing or you're about to get a surgery, there is this idea that you are informed as a patient. You know what's going to be done to you. You agree that there might be consequences before you go forward. And so informed consent is a very well-known thing, but it's evolving over time, right? And as digital technology becomes part of the medical community, we're really struggling with what we call sort of like the armchair philosopher approach and the lawyers. And there's got to be a better way. And so today we're thinking about in the healthcare space how you might invite a new set of ethicists to join at that table, in addition to the classically trained ethicists as well as the lawyers. I am a fan of hugging lawyers. It never works to do otherwise. So terms and conditions in your world, right, if you don't work in health, are really the informed consent of tech, and it's not acceptable. I mean, how many people read T's and C's? Nobody reads T's and C's. You scroll, click, you accept yes, and you move on. But you do not know what you're agreeing to, and it is unacceptable for tech companies to have a 23-page T and C for you to, access Wi-Fi or use an app. In fact, there was this experiment in London that was quite funny where to access Wi-Fi, these people gave up their firstborn child, theoretically. And so I think drives that point home, but we all know that they're not acceptable in their current state. The last thing that the healthcare industry is doing is that they're institutionalizing and operationalizing ethics in the day-to-day. They're doing this in academia, they're doing this in research, and they're doing it in practice. And these are the three areas that I'd like you to think about. As David mentioned, it's not just what is that guy doing, but what am I doing in my own world, in my day-to-day? So the first, Casey, is she here? Casey? Do we all know Casey? So she curated a list of ethics courses. It's a Google Doc. She's got a great tweet storm. Just check it out. People say, shouldn't everyone be learning this? There are people in the healthcare space that are saying that this is a requirement for anybody working in data science as it relates to health. It really should be a mandate for really almost any career going forward in the 21st century. All things are digital, and all tech is human. Do you like that, David?
I like that.
Yeah. So Camille Nebeker is one of my favorite health tech ethicists. She created this platform called Core. It is a place where people can upload their research protocols. So it's something that's submitted to what's known as an institutional review board. And she was particularly interested in how we are looking at mobile imaging, location kind of data. And so she has a resource library where you can share the resources. She has a network and a Q&A forum. Last but not least, you should care, your boss should care, your CEO should care. And I'm going to end on this. DJ Patel wrote this book with Hillary Mason and Mike. What if we all asked about ethics in the interview process? Even better, this week a CEO told me that a developer asked him about his ethics when he was interviewing. Thank you.